So we caught you at ACC, and now we are catching you here at ASPC after your film debut in the Brown Heart film. And you're not only this thriving early career preventive cardiologist, but you've also won Teacher of the Year 2 times over. And now you're dabbling in this space where you're providing really valuable education for a larger audience. Can you tell us a little bit about why Brown Heart matters?
Thank you. You're very kind as always. Brown Heart is an educational initiative to highlight some of the increased risks that South Asians face in terms of heart disease risk. And it's not just heart disease, it's premature heart disease, which is heart disease that occurs at a young age and leads to a lot of disability and a lot of morbidity. So this documentary was by two physician documentary makers who want to spread the word and want to spread the word that not only does this happen, it's actually preventable. And there are things we can do to minimize our risk. And I've always found that mission very worthy, as is evidenced by my participation in the preventive cardiology meeting. So that is why.
And that's why I think these meetings like ASPC are so important, because it gives you a forum to have these conversations. And a lot of these initiatives are physician-led because we see the need in the population, right? So I grew up eating rice, dal, like the traditional Indian diet, a lot of butter every once in a while. But I learned later on in life how to modify my diet to fit my cardiovascular risk profile. What is your top nutrition tip for someone from a Southeast Asian background for what they should or should not eat?
In general, I don't tell people to never eat anything unless it's, high in trans fats. Then there are guidelines that say you want to avoid trans fats altogether. But once you go beyond that, we recommend minimizing carbohydrates that will lead to large glucose spikes. So, for example, white rice is one of those examples. So you try and swap that out with something a little bit that's lower glycemic index, more whole foods. But we usually provide suggestions of what people can do.
What is a good swap for rice? For white rice in the Southeast Asian diet, what is a good swap?
Millets are a pretty good swap. So that they can be cooked kind of similarly. Quinoa is another one that people here are pretty used to. Again, lower in glycemic index, so the glucose spikes are a lot less with it. And we also ask people, if your plate was 3/4 rice and a small portion of vegetables, like swap that around. Like make use the plate model, make a predominance of vegetables on your plate, and then you can have a little bit of rice.
When I first started making that swap, it actually brought my grandmother in India to tears. She was just like, she's not eating anymore. But the thing is, I was eating to fuel my body. And I think a lot of us hold these very strict cultural expectations or norms. And so, let's normalize having more greens on our plate than having rice. And whatever else, somebody eats, just kind of making it so that you can embrace your cultural heritage, but also make it healthy for your body.
Right. I don't think it's, reasonable to ask someone to completely give up everything they've ever eaten and change what they're eating. But it is possible to make these small changes that make a significant difference.
I love that. And what is your favorite comfort food? It doesn't have to be something that fits these rigid criteria, because I have one.
Well, that is tough because it's actually a rice-based dish.
Which one? I didn't know this about you.
Really? Yeah, it's rice and dal, actually.
I love rice
totally
and dal.
Comfort food. And I have modified it to where the dal part of it is a lot larger now.
So I'm coming over for dinner and we have to cook it together.
Let's do it.
Expect a Cooking with the Cardiologist series coming up soon. That's amazing. For me, it's idli and sambar.
Okay, I love that. Yeah.
So steamed, but still has a fairly big carb load.
Yeah.
But it's just something that I grew up eating. It was like the thing that we didn't want to eat in the morning for breakfast because it was every day.
Yes.
And now I'm like, somebody please make me some idli. So that's
yes.
fun.
Yeah, you can make some of these things with millets, actually.
Yeah.
Yes. Yeah.
So we should really actually think about doing like a Cooking with the Cardiologist series for
It'll be so
Southeast
fun.
Asia.
Yeah, it'll be really fun.
Yeah.
Yeah, I actually have some ideas.
Ooh.
Yeah.
Okay, so one last question for you. What is your biggest takeaway from the Brown Heart film?
I think that, we have to accept that South Asians are at an increased cardiovascular risk, and whether that's genetics, whether that's lifestyle, is debatable. But it's also not that you're doomed to get it. There are plenty of things that South Asians can do to modify that risk, and I think that is the big message that we're trying to spread.
You know what? I see patients on the other end of that spectrum where you see the patients who are coming in with a heart attack at 2 a.m. that are in their 30s and 40s. And I think from my perspective, it's just having the awareness that, people of Southeast Asian descent are at increased risk. And so know your numbers, get plugged in early, do all the things that you can do to prevent this from happening. And I think we have so many tools now. And I'm so excited to see less and less of those patients in the cath lab.
I love that. In early screening plays such an important role. Just being able to detect the disease, we can start treatments early, and hopefully you never have to have that 3 a.m. cath lab call.
This is like a full body yes for me. So on that note, intervention and prevention.
All right.
Thank you.